So what's interesting is, and I think this is probably true to an extent for any disruptive technology or treatment, I think the early adopters were really powerful advocates for awareness for flow, right? So you had people who had been suffering for a while, had tried everything. A lot of them had been hospitalized, suicidal, and they were sort of told by, their clinicians, there's nothing else I can do for you, right? Even the best meaning clinicians, like, we're out of options. And so they do their own research. They found flow, and this is very early days. We've had some extraordinary flow user success stories. We've got some early coverage. Interestingly, our first NHS partnerships, I'd love to be able to sit here and say we were very strategic about who we targeted. We did all this research. We went out. But the reality is they found us. Actually, we saw, I've been following this technology for a while, or I understand the limitations of drugs. I've been looking for something that finally had evidence. I want to try it and I trust. And I would say we've been so lucky. That has been the most surprising thing to me, is the response from primary care clinicians and the NHS. Like, they don't have time, but they understand the limitations that they're seeing in their practice every day in the 7 minutes that they're given to treat a patient. And so what we try and do is keep it simple. I think the other great thing about flow for clinicians is, to your point around taking multiple other drugs, or we don't have drug interactions. And so, I'm not sure if people are aware, but a lot of a clinician's time is actually managing all of the different drugs, as do pharmacists, making sure that there aren't negative interactions between them. And that can be very challenging for elderly, postpartum, comorbid patients who are on a drug cocktail. And this is an option where it's very low risk for them. But the fundamental switching point and sort of the 6 or 7 trusts where we're active now is they've got to say, will a patient use it? Like, there's that question, like, no one's going to wear a headset. Come on. And then they do. Actually, over 90% of people who are offered flow chose flow over drugs. Is it easy for the clinicians? Is it more work for them? Like, right or wrong, they're time constrained. And then do they see the results at the trust level? And I think the challenge for technology, you have to do all three. Clinicians have to be willing to prescribe it, or it has to be easy for them. Don't make more work for me. Patients have to like it. They have to use it. You have to have results. You have to save them money. And I think we're able to do all of those things, which is, we certainly don't take for granted. But I think what we've seen is then in that success, all of the subsequent trusts came from the results of those early trusts. So, like, it's one thing for me to go out and say, flow works, look at all of our clinical trials, look at the 8 NHS studies we've done. But the other trusts tend to trust their colleagues. And in fact, based on those early results, our first commission trust in the NHS was actually Practitioner Health, which is a trust that delivers care to NHS clinicians themselves. So I don't know if that is any indication of perhaps the openness of clinicians to engage with the technology. Now, that sounds wonderful. Like, why isn't it everywhere? I think there's definitely challenges around budgeting and access and proving for different populations. And again, I would say that's mostly primary care. We've definitely had a different experience with psychiatrists, with private psychiatrists. I think they're much more skeptical, or I know they're much more skeptical. So that will be a continued battle.
And why would they be more skeptical? What's the difference between being primary care and being... Is it that actually that would end my income flow?
So there's definitely an element of that. And this is going to be contentious, but so in primary care, right, you're given 7 minutes to see a patient. So you only have so many slots, right? And what you don't want to be spending time on is, you don't want to be sitting there with a patient that you can't actually help with the tools that you have. And so with Flow, 53% fewer appointments for a couple of reasons. One, it's more effective. 2, you don't have drug interactions, so they're not coming back. You're not switching meds. 3, you can actually manage it remotely. So we provide insight to clinicians. They can see who's doing the treatment, how they're responding. They can be more resourceful. That's what we've seen with community mental health. So they really like that, right? So I'm not going to say that primary care is trying to get people out of the office, but that is sort of true.
Focused, but it's data led. And they're looking at operating in a much more finite kind of so what space in the immediacy. If you can do that, and if you flick that domino and it releases those other 3, I'm all in.